Attention deficit disorder with or without hyperactivity is not just a children's diagnosis.
Hi, my name is Jada Eichmann, and I was diagnosed with ADD late term as an adult. And I have a few methods that I like to use in order to help me keep my life in order so nothing derails too much. And those simple methods are, the first being I like to take notes. The Notes app on my phone is always up and running. Pretty much when anything pops into my head, especially if it's an idea or something I have to do, I have to write it down immediately. The second being, I like to set alarms. I have many alarms for many things, and I need those alarms because ADD can also cause you to kind of be blind to the time, as you often forget. So those alarms help me kind of stay in line with what I need to do for the day. And last but not least, I have to do, or I try my best to do things as they pop into my head. So if a task is there present in front of me, I try and do that task first, because often if I try to set that task aside and say I'm going to get to it later, I'm not getting to it later. I'm going to forget, or I'm often going to do 1,000 tasks at once, and that task is often going to get left on the back burner, unfortunately.
Hello, this is Dr. Kenneth Hudson. I am the President and Chief Executive Officer of Life Coaching Systems. Life Coaching Systems is a unique practice designed just for people to solve their problems. One of the things that we specialize here in our practice is how can people live their best lives. When we talk about attention deficit disorder, a lot of times that people are diagnosed with attention deficit disorder in childhood. A lot of times these things, they manifest themselves in people not sleeping, people not getting enough sleep, people not eating or doing those types of things. Their mind is always working. A lot of times those things carry on into the adult years, and so you have a lot of adults now who have attention deficit disorder, but a lot of times it's not diagnosed, and so people, it might manifest themselves as anxiety disorder, it might manifest themselves as depression, but it's really adult onset attention deficit disorder. These things have to be treated just like anything else, just like high blood pressure or diabetes. Attention deficit disorder is a medical disorder. Yes, that's what it is, a medical disorder. So it has to have a medical component to it. And sometimes that we might have psychotropic medication that's prescribed to help a person be fully adjusted. Sometimes you might have different things like exercise or changing a person's diet, getting enough rest, those types of interventions that we use for adults. But the main thing is that it's a combination of psychotropic medication. There's a combination of things that you can do, common things, like I said, like exercise. But we want that person, because you can live with attention deficit disorder as an adult.